This is Jeremy with CryoClarity, and in this video we'll be going over the ventricular inflow and outflow tracts. And all that is a little bit more specific into the blood flow of the heart. So if you've already watched my last video, or if you want to pause the video and go and watch that before coming back, that should set you up for what we're about to go over. In that last video, I talked about how three venous structures dump into this right atrium. Those three venous structures are the superior vena cava, the inferior vena cava, and the coronary sinus. So those three structures dump into the right atrium. Now, to get into the ventricular inflow and outflow tracts, blood from the right atrium passing through the tricuspid valve into the right ventricle is what's known as the right ventricular inflow tract. A tract is a pathway. Inflow tells us that blood is coming in and it's coming into the right ventricle. Therefore, right ventricular inflow tract is characterized by blood coming from the right atrium through the tricuspid valve into the right ventricle. To the same degree, we have a right ventricular outflow tract, which is associated with blood leaving the right ventricle, passing over this region through the pulmonary valve into the pulmonary trunk. Now, what's important to note is that this region here has a specific name. This is known as our conus arteriosus, also known as our infundibulum, and therefore this region, the infundibulum or the conus arteriosus, is associated with the right ventricular outflow tract as blood leaves the right ventricle entering the pulmonary trunk through the pulmonary valve. Just as we had a right ventricular inflow and outflow tract, we'll have a left ventricular inflow and outflow tract as well. Now, the blood gets to the left atrium through the two left and two right pulmonary veins, 4 pulmonary veins total, 2 left and 2 right, all dumping into this left atrium. But this is where that left ventricular inflow tract will begin, as blood comes from the left atrium through the mitral or bicuspid valve into the left ventricle. That would be our left ventricular inflow tract. And the left ventricular outflow tract would be characterized by blood leaving the left ventricle, passing through the aortic valve, and entering the aorta for systemic circulation. So that ends the left and right inflow and outflow ventricular tracts, and I hope that makes it a little bit clearer as to how that blood flows.